Welcome back to another one of our video discussions here on the COVID-19 situation that we're going through. And today we're going to talk about an issue that everybody is talking about. And to most people, it makes absolutely no sense at all. And it's one of those things that is clearly causing more damage to people than it could ever possibly be a benefit. And many people feel that, know that, but they're not really sure why. And some people have just gotten totally carried away with this issue of mask. Then many of you have run into the problem. If you had your nose exposed and went into Walmart, surely someone shook their finger at you or said something to you. You can't get on an airplane without being harassed about it through the entire flight. And I just had a call this morning from someone in one of our hospitals here that was there with his mother. And overnight, they had changed their rules there, now requiring that if you're in the hospital, they're in the hospital, you wear two masks, a mask and a shield and gloves. And as I was talking to him, I could hear in the background, they were threatening with the police to have him arrested if he didn't get properly masked up. And so I think we have just about gone off the deep end with this thing on something that I think when it's all over and done with, history will look back and we'll point to a huge amount of damage that was done to people physically and mentally, and particularly our kids that are going to be forced to wear masks in some of the most unbelievable circumstances. I mean, the stories I've gotten of some of our athletes being required to practice with wearing a mask in the hot sun, and other stories are just beyond the pale. And so today we've got some of our doctors that are very well versed in this issue. And we're going to start with Dr. Tom Reed, who has researched this and studied it. And he's going to talk about how bad this situation really is. So Dr. Reed, if you would take over, sir. You need to unmute. Unmute.
Now, okay, thanks.
There
Bob.
you go.
Thanks. When we look at this big picture puzzle, if you will, of the coronavirus pandemic, there's a couple of bigger pieces to that puzzle that tend to stand out. And I think that most people would agree that some of the main questions that they may ask is, number one, am I going to get coronavirus? And number two, I'm going to die from it. And so I think it's fair to say that most people are really very concerned with that. And that's kind of driving everything, many of the policies at least, that have come down is based on that idea of fatality rate. And so when we look at that, of course, then perhaps the smaller pieces of the puzzle have to do with, okay, well, now that we know what the rate is, and what do we do about it? I mean, how can we protect ourselves? So the natural question also is, can masks help us from, number one, catching coronavirus, and number two, will it help lower the fatality rate? And are my chances of dying a lot less because I have on a mask? So I'm going to kind of go through not only efficacy, but also safety of mask wearing as well. So I'm going to go ahead and start showing the slide here. Hang tight. There we go. Can we see it? Are we okay?
Yes, it's good. It's up. Looks good.
All right. So the first thing that I'd like to just share briefly is that there are actually 7 types of coronavirus. There's 4 of them that are responsible for the common cough, cold, flu symptoms that we generally see on a yearly basis. And then there's 3 that are more, what they're considered more pathogenic. And they're actually related to each other in probably some very unsavory ways. And that's a topic for another discussion. But these particular viruses, the MERS virus, the SARS-1 virus, which occurred in 2003, and SARS, are more pathogenic. And so I just kind of wanted to give a big picture, because just because somebody has tested positive for coronavirus or has had some type of antibody test or measured other immune factors which show that they've been exposed at some point in the past to a coronavirus, that doesn't necessarily mean that it's SARS-2. And I also wanted to mention that the vast majority of cough, cold, flu symptoms that we see on a yearly basis are really related to rhinoviruses. And second, actually, are those, especially those 4 coronaviruses, which account for 12 to 15% of the cough, cold, flu symptoms that we'll see on a yearly basis. And influenza is even less than that, 7 to 12%. And you can actually have co-infections as well. So you can have all 3, you can have 2, you can have 1, and they don't routinely test for those 3 on a yearly basis. Okay, well, let's talk about how contagious this virus actually is. And these statistics that I'm showing right here now came out in February or March. And these are global statistics that are based not only on history, but for COVID-19, these statistics of what's called the RO value, or R naught value, is actually based on a study that was done in China. It was a very, very small study. And they predicted that the number of people that would get infected from one person getting exposed is 2 to 4 people. Now, if you compare that, for instance, to measles, measles is very contagious, but it's not deadly at all. Very, very few people die from having the measles. And so you can just compare the two and then go down to the seasonal influenza, which is very similar to COVID-19, at least in the very beginning, when these statistics were first put together. But this particular connection here is very important because hang tight just for a second. I want to get rid of some pictures here. There we go. There's 1 billion cases of flu every year, and there's 21 million confirmed cases of COVID-19. So is it a fair comparison to the flu? Well, yeah, it is in a lot of ways, and I'm going to cover some of those because it's important for us to put all of this into perspective. So right now, worldwide, compared to the flu cases every year, the number of confirmed cases of COVID is small, relatively small compared to the flu. Also, for the 2017-2018 flu season, there were over 48 million plus cases, because not every case of the flu gets diagnosed, and there's a lot of people running around who have had the flu that don't go to the doctors. And actually the same thing exists with COVID-19. Over this past 8 months, there have been about 6 million cases. So you can see right here that the actual RO value of the seasonal influenza is actually a lot higher than this global number that they have, 1.3 to 3. It's actually a lot higher than that. So these statistics, these numbers that they put out there on a yearly basis, we can't put a lot of reliability into those numbers. But what we can do is take a look at, for instance, in the United States, where there's been 48 million cases in 2017, 2018, and only 6 million cases of COVID. So that just kind of adds to the puzzle. It adds to perspective. well, how deadly is it? Well, that's what everybody wants to know. Am I gonna die? And if you look at Ebola on the top, it has a track record, and that track record says that it's about as contagious as the flu, but about 50% of the people who contract Ebola are going to die from it. The first SARS in 2003 has a 9.6% fatality rate, case fatality rate. And so when these numbers were first coming down for COVID, again, they did a study based in China. It was a small study. And what they found was that, or what they predicted was that there would be a 3.4% fatality rate. And this is what the Contagion model was based on, that was promoted out there, that caused so much panic and fear that we're still experiencing today. The suggestion was that millions of people were going to die from this. And everybody was very concerned. Again, am I going to die? They were asking the question, and a lot of decisions that were made by people who are not medical professionals or researchers in this area were making policy that included the mandates, the face mask wearing, and so on. And the problem was that what they forgot to include were the numbers of unreported cases. And when they included the unreported cases, it brought that, what the suspected unreported cases, it brought that number down to 1.0%. But nobody heard that. When that came out, it just kind of got lost. And everybody just remembered the 3.4%, thinking that there would be millions of people in the United States who were going to die. Now, if you compare that 1.0% to the flu, it looks like it's about 10% more fatal or deadly than the flu. And that raised concerns as well, but that's not a real number, and I'll show you why. So the reported deaths that we have here are 187,000. That means that 0.047%, any one person in the United States, based on population, the death will be 0.04%. That's a pretty small number. The case fatality rate is going to be 0.1 to 0.4%. That's actual deaths based on the estimated actual infections. Less than 0.05% will die of those people that are 49 years old and younger will die from this. Those are the estimates. And under 18 years of old, there's negligible deaths. So the majority of all COVID deaths are coming from about 0.62 of the population, those in nursing homes and assisted living facilities. Now, I want to go ahead and skip to, I just kind of wanted to give a big picture of what we're dealing with here. So I'm just going to skip real quick to masks. Okay. Okay, can we see that or not? Honey, I'm not on it. No,
No.
I can see it. Can you
No.
guys see that?
No, we cannot.
Okay, so I've got to share. I've got to go back and share. Screen share. There we go. Oh. Okay. Can you see that now?
Yes, we can see it. Got it.
Okay.
Looks good.
So let's talk about masks. And what we're going to talk about initially is, well, can this virus get through the mask, or how effective is it? We're going to talk about efficacy first. And what I want to share to start with is that there's been a lot of studies in the past to show the relationship between permeability of flu viruses and masks. And that is the history that we really have on masks. There was really, until very recently, there was really nothing to show for coronavirus except for the 2003 SARS-1. And so this is actually a very fair comparison because they're very close in size. They're both about 0.1 microns. And the question is, okay, well, I get that. I'm not sure what that means, but bottom line is my mask going to filter that out? And so let's take a look at that. In a surgical mask, which is very porous, this is what I wear when I'm in surgery. There's about 70% of the outside air moves through the mask and about 30% travels around on the sides. And so what there have been several studies that have compared the filtration of the N95 masks, which are really called respirators, and compare that to the filtering capacity of a surgical mask. And what they found was that there's basically no difference in the filtering capacity because the N95 masks can only filter out 0.3 microns and bigger, and the coronavirus and flu particles are much smaller. They're about 0.1 microns. So that kind of raises some questions about efficacy of these masks to start off with. Now, there's a lot of masks in between that, but this is a good start, and I'll show you how this all plays out. There was an article here that also demonstrates that the effectiveness of N95 masks versus surgical masks in protecting healthcare workers from acute respiratory infection. This is a systematic review and meta-analysis. And when you include something called meta-analysis, that's a word for a fairly large comparative study. And what they found was that the results of our systematic review and meta-analysis shows that there was no significant difference between N95 respirators and surgical masks. Also, what they found was that the infections with the influenza virus rarely produced aerosols that contained infectious particles. As a matter of fact, these viral particles could not be detected on a mannequin that was right in front of somebody that was breathing and counting and coughing and laughing. So that was a very significant finding in terms of transmissions and ability of these viruses to be in an aerosol and then infect somebody that's around them. So very much like the flu, there is some evidence that the virus can possibly be in an aerosol form as well, but all the studies in the past have shown that the significance of this has really not been determined, and very much like the flu, it is by far spread through contact. Even the CDC has made a statement of efficacy, and what they have said that most people who develop SARS become infected through contact with other people who are ill with SARS, not by breathing contaminated air. So if a person does contact SARS virus, it is most likely to be on a surface such as a doorknob. And that the best protection is to wash your hands and avoid touching your eyes or your nose. Well, I don't know how you feel when you wear a mask, but when I'm in Costco wearing a mask because I have to, and I want to go in there and get my chicken wings for dinner, and I have to wear a mask in there, I'm constantly fidgeting with my mask. And so it's actually contributing, masks can contribute to the problem of infection because most people don't know the rules of the road wearing masks, that you're not really supposed to touch them, and you are to change those masks very frequently, especially after you've touched them. Most people don't know that because this is what's called a nidus of infection. It's the mask itself can make the contraction of the virus or bacteria or any other infectious particles more likely. There was an article in this Center for Infectious Disease Research and Policy, and it was commentary, Masks for All of COVID-19 Not Based on Sound Data. And their conclusion states that there's no scientific evidence that they are effective in reducing the risk of SARS-CoV-2 transmission, and sweeping mask recommendations, as many have proposed, will not reduce SARS-CoV-2 transmission. And finally, masks may confuse that message and give people a false sense of security. And I think that's very true. Now, I also pulled this article out of New Delhi in India, where they are dealing with pollution problems and have been for decades. And so they're experts on masks because a lot of people in that area wear masks. So they've studied it quite a bit. And what they have concluded was that a mask may also cause respiratory distress and become a hotbed for microbes to thrive. And they clarified that by saying the moisture from exhalation inside the mask becomes an ideal place for a virus and bacteria to thrive. And this is Dr. Saha. He's a scientist and additional director of the Central Pollution Control Board. He said it can also lead, not in everybody, but it can also, and it also depends on how long wearing it, but it can lead to oxygen shortage, suffocation, respiratory trouble, and even heart attacks. This is what they find in countries and areas where they're wearing masks all the time. They study this, they look at it, they know what the problems are. Also, respiratory consequences of N95 type masks usage in pregnant healthcare workers. This is a controlled clinical study. Now, this is important, not so much, well, it's important for pregnant women, but also it says a whole lot more because this applies not only to pregnant women, but to everybody. And one of their conclusions was that breathing through N95 mask material have been shown to impede gaseous exchange and impose additional workload on the metabolic system of pregnant healthcare workers. And this needs to be taken into consideration in guidelines for respirator use. So there's a lot of people out there who are thinking that, hey, I'm just going to increase my likelihood of protection by having an N95 mask. And the studies are showing that's not true, even when compared to surgical masks. They're not anywhere, they're not any more effective than a surgical mask, which is very, very porous. Here's another study on N95 respirators. And the conclusion was that the use of N95 respirators compared to surgical masks is not associated with lower risk of laboratory confirmed influenza. So that means it's not very effective. And here's one more study that shows that we tested a total of 44 mask brands of 4 types. We tested medical masks, general masks, and handkerchiefs that were found to provide little protection against respiratory aerosols. So even if bacteria or a virus, whether it be influenza or COVID-19 disease, even if that is aerosolized, your protection is very minimal. And people should not have this false sense of security that by wearing a mask, they are protected from catching this virus. Now, in late May, when the fatality rate really started to bottom out, the CDC was still recommending, even in the midst of the height of the fatality, the CDC was recommending that not to wear a mask unless you were sick or unless you were around somebody who was sick. And that continued until late May. Even the WHO guidelines said exactly the same thing. If you are healthy, you only need to wear a mask if you are taking care of a person with COVID-19. This was late May guidelines. And they've gone back and forth with it, but this is the one that they stuck with for a while. So are there any complications? How about safety? Are there any complications from wearing a mask? Well, the World Health Organization says there is. They write that there can be an increased potential for COVID-19 to infect a person with masks. They also state that there can be difficulty in breathing. You can have facial skin breakdown, difficulty in communicating clearly, and they're uncomfortable to wear. When they're uncomfortable to wear, you're going to put your hands up on the mask and try to adjust it, which also leads to increased risk of contamination. And again, there's also a false sense of security associated with masks. Now, I'm putting this up here just to kind of give you an idea that there are a lot of people out there right now who are experiencing problems with infections associated with masks. And some of these are in hospitals, and some of them are by nurses in offices, and some are by other people. And just to kind of give you an idea here, one of them says, I'm an ICU RN. We have 0 COVID patients in our unit. What we do have is a big increase in patients with antibiotic-resistant pulmonary staph infections from masks. Staph infection on my face due to mask wear equals heavy antibiotic, stomach ulcers, up all night, dry heaving. I'm an RN, and this is absolute fact. We have treated more staph infections on the face than I have ever seen before in the past 2 months. New development this week was thrush in the mouth. And this, again, was related to wearing masks. So you can see that there's a lot of people out there who are having these side effects that the World Health Organization has warned about. They're very real. Now, I'm not going to go through all of this. I just want to go to the end and help you to understand. These are 42 studies related to the side effects of masks and how efficacy and safety of masks. And I have more than this, but this is just kind of a main list of research articles that are related to mask wear. And well, how about masks and social distancing? Do they really work? Well, I think that one of the best ways that we are able to tell is to kind of take a look at the protests that have occurred. And what they're finding in looking at whether there have been spikes in all of these places that have had protests where people are not wearing masks and they're not social distancing is that they're not finding spikes or increases in COVID. Now, that's got to say a lot. And what does Dr. Jerome Adams, U.S. Surgeon General, have to say about all of this? He says, I want Americans to know that even when you look back at past infectious disease outbreaks like this, they weren't ended with therapeutics or vaccines. They ended with hand washing. They ended with social distancing. They were ended with basic public health and hygiene measures that kept us safe from the flu and everyday cold and will keep us safe from the coronaviruses. Masks do not prevent you from getting the coronavirus. And when he's talking about social distancing, he's talking about the same kind of thing that we would experience if we were around somebody who has the flu. If one of your kids has the flu, you're just going to isolate them. You're going to put them in the bedroom. You're going to, quote, social distance, if you will. And, when you bring them in food, you bring them in chicken soup and everything else that's going to be very helpful for them, but you're going to be very careful. You might even wear a mask when you go in the room or cover your face, except for mamas. The mamas don't do that. They just go in anyway without a mask and they hug on love on their kids. They don't care. Now, I do want to end this by mentioning that it's not just us who are concerned about all of this. People around the world are really, really mad. This past weekend, there's reportedly hundreds of thousands of protesters in Berlin, London, and in Spain who feel the same way that we do about this. They want all of this ended. They understand that the masks don't work. They understand that the mandates don't work. They understand that their freedoms are being taken away. And if this goes on, if we just lay back and let this happen and live like zombies here, what's going to happen is that the government's going to overreach even more. And my biggest question, I look back at what we're doing here in the United States and what we're not doing. And the way I feel about it is just asking this question of the audience and everybody else that I talk to. Why are we so complacent with all of this? Why are we ready to be sheeple and be led around by the nose by tyrants? And it's like we've lost our ability to think. And people need to take a breath and step back and think about what is going on here. So I'm done, Bob.
That's great, Tom. Thank you very much. That was that was very comprehensive, and I am glad to see you brought out all of that rationale behind the fallacies of this. And I see that Richard Urso has joined us now. You can tell he was busy by the way he's dressed. Working today. Very good.
Have my mask.
Yeah, I see you do in there. Richard, would you like to follow up with what Tom was saying, and what would you like to add to that?
Yeah, I'd sure love to. You know, Tom and I think a lot alike, you know, kind of data guys. I definitely want to talk before Dr. McDonald. He's so wonderful when I love hearing him speak. So what I was going to say was, you know, this whole process, when we started out, you know, back in the early part of the year, we started hearing about, you know, let's get our protective equipment, and then we were really just thinking about our protective equipment so we can deal with our patients. Not that we thought the whole world was going to go around with protective equipment. But, you know, that protective equipment has been studied for a long time, as Tom pointed out, multiple studies. And I thought we heard a pretty fair statement from Fauci, in which he backtracked on later in February, where he said, you know, masks against infectious diseases are not really that effective. And I think there's a tremendous amount of data, as Tom just pointed out. You know, we've got studies from, you know, 2009 showing this randomized controlled trial looking at the N95 and surgical masks. In Japan, it didn't stop the common cold. You know, it's we know that. In fact, those kind of studies have been done multiple times. They looked at face masks to prevent transmission of the flu virus. Also later, another analysis in 2010, and they don't prevent transmission of the flu. And basically, this kind of stuff has happened over and over. And as Tom pointed out, part of it is the size of the holes. The N95, which is what we consider to be our sort of gold standard, and these surgical masks just cannot contain a flu virus, and they can't contain the coronavirus. And more interestingly, with the coronavirus, the SARS virus has a lipid capsule, and that N stands for non-oil resistant. And that means that it's not sticking to water like they said it's in a water droplet. When was the last time you saw oil stick in water? So the SARS-CoV line has a lipid capsule around it, and it slips right through an N95 mask, even more so because of its lipid capsule. And it's getting right through there anyway, because the size of the capsule is, I mean, the size of the micron size is smaller. The virus is smaller than the size of the openings. So, you know, that's the studies, they keep repeating these studies over and over. One meta-analysis from 2012 at 17 studies It does not protect against the flu, neither N95 or surgical masks. Another from 2016, there were 6 studies that were combined, and they found no difference between N95 and surgical masks for prevention of respiratory infection. In fact, they just didn't help. So I think, as we look and get closer to 2019, there's another analysis. They did a randomized trial. They had 2,800 people, and there's no difference between N95 and surgical masks against viral illness. And finally, in this last year, they have had 6 RCTs that were combined in a total of 9,100 patients, and the N95 versus surgical mask does not help either versus the flu. So I don't think it's a stretch to say masks don't work. And I think people, I feel badly because it's basically taking away people's feeling of security. But it's a false sense of security. And I think it's time that we just reveal that and let people know masks are not protecting you against this SARS-CoV-2 virus. The virus has a lipid capsule. It slips right through. If you're really interested and you're that involved in wanting to try to protect yourself, you need to find a completely form-fitting mask. It needs to be like an R100 or R99 or a PAPR, which looks like a spacesuit. And you have to have goggles that are form-fitting. And if that's your goal, is to protect yourself against this virus and do it with some sophisticated means, then go for it. But otherwise, you're just wasting your time. You're creating we have the wrong message being sent, and we cannot get ourselves away. And that's what I wanted to talk about, Bob, is the messaging is still social distancing, masks, wait for a vaccine. And it's time we take the crutches away. We cannot rely on this mask until we get a vaccine. We cannot rely on social distancing until we get a vaccine. What that means is we're going to ruin our entire economy. This is not a sustainable model for our country. And the mask and social distancing are being used as a crutch to get us to the vaccine. And it's a false sense of security. And it's up to us to kind of let people know, look, you can wear it. You want a false sense of security? That's fine. I personally look forward to hearing what Dr. McDonald has to say about how this affects us from many psychological standpoints. But to me, I think I've always liked to practice where I gave my patients something that they could do to help themselves go forward. And so what I'm going to say to anybody listening to this, early treatment, prophylaxis with hydroxychloroquine, even nutritional prophylaxis. That's if you want something to do, that's what you need to do. There's wonderful effects from some of the things that we can do to help influence our health. Vitamin D, quercetin, zinc, melatonin has wonderful effects against NLRP3 inflammasomes, which helps in the second part of the disease, and then maybe even a baby aspirin if you get the disease, because blood clots are a big part of this virus. You want to do something that you could do at home over the counter. Those kind of measures make some sense. Of course, I would do that in partnership with your doctor. But this whole thing about the masks are going to save us, we just need to get past that and educate the public and let them know they're not. The vaccine, as we know, coming forward, is going to be very difficult to have a vaccine that's against this highly mutating RNA virus. Like the flu, it's very hard to pin it down. And what's coming first, the chicken or the egg? The southern hemisphere relies on the northern hemisphere's flu virus every year, and the northern hemisphere relies on the southern hemisphere's flu virus every year. And of course, it's like a shot in the dark. We sometimes hit it okay, maybe get up to 50% success, but typically it's a lot lower than that. So we're going to be probably doing the same thing with this vaccine. And I think it's time that we sort of say to people, like was mentioned, we need to wake up. Since when did Texans, for instance, take this lying down? I saw people in New York saying, we're not taking this anymore. We're opening our parks. And they saw them, they took the locks off and they went and opened their parks and said, we're gonna take our chances. You want to come and arrest us? Come and arrest us. This masks are not working. I'm wearing it today because I'm mandated to wear it. And me being a physician, I literally I have to wear it. And if I don't, I literally will probably suffer from the board in some way. And even though it doesn't work and the science is all there, it's insanity. Now, I'm going to say that because I don't think they're super dangerous, at least in my mind, because I've been wearing them for 30 something years, I'm willing to put up with it. I don't jaywalk when the policeman's at the crosswalk, but if he's not there, I'd probably jaywalk. So the bottom line is, I think there's more to it though. And I'm going to say that this is a control thing that I think there's a lot more to it, but the science, and I'll speak to the science because that's very simple. The science does not support what we're trying to do. It just doesn't.
Okay, Dr. Urso, thank you very much for that. And you're absolutely right. You've been in the middle of this. We've talked a number of times, and the main point there that with you and Tom was wanted to get to the point out there that this is a false sense of security. That's a part of the strategy we currently have, which is totally defensive. It's mask, lockdown, and isolation. All defense. There is no offense in our current strategy to go after the COVID. We have sidelined and the doctors in this thing. Here we are in the middle of a medical disaster. This is the COVID is a medical issue, and we have sidelined our doctors and thrown in this silly nonsense of we're gonna win this thing or fight this thing with mask and isolation and lockdowns with no plan other than just hope the COVID goes away. And I think Ronald Reagan was absolutely right. Hope is not a strategy. And so pointing out the fallacy of this to people who get to understand that part of this thing is an absolute waste. And actually, I think what Tom pointed out there, for many people, because of their physiological makeup, it is a danger to their health. We are putting people absolutely in danger to it. But now I'd like to go to with Dr. Mark McDonald, because this is the side issue here, is that our children, one of the reasons adults are put on earth is to look after the children that come after us. One of the biggest responsibilities we have as adults is the education and safety of our children. I'm talking about us as adults, not as government, but we adults, the education of our children and their safety until they're able to make good decisions for themselves. We have that responsibility to put them in the best possible environment and provide what's needed for them to mature, to be adults. And what we're doing with our children with this approach we're taking of distance learning and mask and other things that is totally disruptive to the development of the kids are things that, while wearing a mask might be a temporary inconvenience and cause a temporary problem with us physically or with some people physically, I think what we're looking at, and I want for Dr. McDonald to, I'm sure he'll address this, we're talking about doing things that could be irreparable to kids that because of they'll be in their formative years here of depriving them of what they need to actually develop. And so, Mark, welcome. Glad to have you. Appreciate you taking the time to talk with us today. Tell us about what's happening with our kids and adults as a result of what we're doing with this defense only and strategy we currently have.
Dr. Urso and Dr. Reed both really, I think, very effectively put to rest the fallacy that the use of masks and what I call social isolation, not social distancing, actually protect us from illness. They don't. And this fallacy is based on this delusion that healthy or asymptomatic people who are infected but don't show symptoms are somehow at risk of being super spreaders to the rest of us, and they're going to kill grandma and grandpa, or severely ill younger people who are at risk of hospitalization, intubation, and death from coronavirus. And that's simply not true. It's not based on any science. It's completely non-empirical. It's essentially based on fear. And what has happened, as you said, Bob, is that fear and the implication of fear, which is mass policing, has really replaced medicine and science as the compass that's guiding us here in this pandemic. The problem, the consequential problem of that is not just that we are doing things that give us a false sense of security, as Dr. Urso said, such as staying away from people more than 6 feet, which is an arbitrary decision and mandate, or placing coverings over our face, which is completely unscientific and actually promotes health problems, infections, poor immune system, deoxygenation, all kinds of nasty stuff. But more importantly than that, it actually harms us. And it harms us in a very significant way that goes beyond just medical harm, which is psychological harm. Just yesterday, I received a letter from Delta Airlines banning me indefinitely from flying on their airline after I took a flight a couple of weeks ago where I was admonished by one of the stewardesses for not having my mask pulled up over my nose. And then secondly, for drinking water for too long. He actually said to me, "You've been drinking that water for over 3 minutes." I asked him if there was now a time limit for how long we could breathe or drink. And he got very confused, and he told me actually in his own words that you can eat and drink with your mask on. I repeated that back to him. And I said, "Did you just tell me that I can eat and drink with my mask on?" And then he corrected himself and said, "Well, what I mean is you can eat and drink, and then you can put your mask back on." And I said to him, "That's exactly what I did." And that's when he told me, "Well, you've been drinking for over 3 minutes." Apparently he had a stopwatch and he was timing me. Turns out he was a former police officer, and he literally became the mask police on the airline. So I'm no longer able to fly that airline. And he told me, "If you don't like the rules, you can take Greyhound." Well, if I'm going to be banned from every airline, I really literally cannot fly and cannot travel within the United States anymore. That's actually a loss of liberty, which has no benefit because there's no medical benefit to having fully complied with those rules. I can handle that as an adult. I can find other ways to get around, but it does certainly create constraints on my life. As a child psychiatrist, my more serious concern is not just for the adults and the impact that it has on them, but the effect it has on children. I already see in my practice that my adult patients are becoming more sullen, more irritable, prone to drinking, using drugs, becoming not just irritable, but explosive, sometimes violent. I lost my first adult patient back in April to a fentanyl overdose because she had been so isolated when her school closed, her therapist stopped seeing her face to face, and all of her AA meetings were canceled. She decided to start using drugs out of depression and out of a sense of loss and pain. And she was found the next day without breathing. She suffered respiratory failure and she died. I've seen now the chain reaction of that effect on adults who have children who, as sponges, suck in all of the anxiety, all of the fear, all of the mental illness that is growing in the adult population. And they start to act out. They start to wet their bed. They start to become more prone to phobias. Being around people is now scary for them. They cry. They can't concentrate or focus. I have a lot of autistic patients in my practice, and they've all become aggressive. Some of them have started to punch and attack their siblings. One actually broke a plate glass window last week, an 8-year-old boy, with his fist. And this was not an aggressive or violent child. Just 3 days ago, I was told that one of my 14-year-old patients, also mildly autistic, had to be sent to a psychiatric hospital on an involuntary hold and given intramuscular injections of medication to sedate her for 2 to 3 days because she had begun pulling her hair out and punching her sibling with her fists. This is a girl who had been completely placid, friendly, and actually verbal up to just a few weeks ago.
You know, his talk about mass policing is one of the real dangers of mass. I've faced it. My wife has faced it. I've got people that I walk into a store that the only time I'm spoken to is somebody told me I had cut the bottoms of these off. And so my mask was fitting. And because I know I have metal in here, I can make it fit without it. And they told me I would not be able to come back unless I had these tied around my head. And I said, the mask is fitting perfectly. They said, no, you need ties on the tops and the bottoms. And I'm having these kind of conversations with people where people are coming up to me being the mask police. And like Mark said, it's crazy to think that this is where we've gotten. So beautiful words. We're all experiencing this. And I just can't believe we've gotten this part in society where something that doesn't work is now creating so many problems for us on airplanes, going into stores, walking into classrooms, patients in my office. And it doesn't work. It makes no sense. Sorry, Mark.
I wanted to sort of lead up to a very important point regarding the psychological effect on children after having given you a few anecdotes of what I think is really representative of the injuries that are taking place in the pediatric community psychologically, which of course affect them physically, emotionally, developmentally, which is this. As long as we continue to mandate the use of masks or face coverings, including this social isolation among children, asymptomatic, healthy children who, as we know from undeniable, irrefutable, worldwide scientific evidence, do not become symptomatically infected or die of this disease to an almost 99.99999 percentage. We've had absolutely no deaths in Los Angeles or Orange counties. We've had only a handful in the state of California, and those 3 children were very ill to begin with. Far fewer children are dying of this than of influenza, and we've never, ever done anything such as masks or social isolation for children during influenza epidemics or bad seasons of flu that happen every year. Because of that fact, that is an irrefutable fact, there is absolutely no reason for us to continue these masks and isolation mandates for children in schools. And as long as we continue to hold to them, children are not going to be able to return to school. They cannot, in most cases, appropriately use masks. And even if they could, it would create such developmental problems for them because they need to learn and grow by seeing people's faces, seeing people's expressions, by reaching out and touching their friends, by playing, by sharing crayons and toys and food. These are the ways that children grow. These are the ways that children solve conflicts, learn how to tolerate frustration, rejection. Any sort of challenge in a social setting requires physical contact and the ability to touch and see other people. That is inarguable among developmental psychologists, inarguable. And so as long as we tell children they cannot return to school without masks and isolation, we are effectively keeping the schools closed. The consequences of that are catastrophic. We are looking at an entire generation of children that are going to lose at least one, perhaps more than one entire year of school, social development, psychological development, physical development by being ordered to stay at home with their parents under incredibly constraining and stifling conditions without the ability to see their friends, without the ability to play, to practice sports, not to mention, of course, the basic educational experiences of learning how to read, how to write, how to calculate, how to do science, how to discuss and critique. This is not just a 3-week or 4-week or 4-month prolonged stay-at-home staycation. This is a slicing out of an entire period of time, which for a child, a year is a very, very long period of time that will never be able to come back. And in the meantime, the children are, as I said, developing worsening anxiety and depressive disorders. Suicidal ideation is now up 100% according to the CDC's report 2 weeks ago. The prevalence of anxiety disorders has gone up 300% compared to last year at the same time. And the prevalence of depressive disorders is up 400% compared to the same time last year. This is not a small difference. This is not a 10 or 15% worsening. We're talking about double, triple, and quadrupling of emotional illnesses that lead to severe morbidity, illness, and in many cases, death. So bottom line, the ongoing mandates for masks and social isolation in the pediatric population is no longer an error. It is no longer a mistake. It is no longer a better safe than sorry measure. It is already sorry. It has actually now become abusive. It has become intentionally harmful to children. There is no excuse for that. We are being derelict in our duties as adults to care for and to love and cherish our children. We are actively harming them when we know beyond any dispute that there is absolutely no medical benefit to it. It is an outrage. I am angry just thinking about it, much less talking about it. We need to reverse course. We need to toss this. We need to get children back to school immediately.
Wow. Thank you very much. I hope people are listening. I hope people are hearing what you're saying. All three of you. Now, all three of you are what I call real doctors. You real doctors, you have patients. That's where you are. You're front line, your boots on the ground. You're out there actually doing what you were trained to do, what you took an oath to do. And yet what you're seeing is you're swimming upstream in a current that has been created by people who have a title doctor after their name, but that's a title only. I mean, I take a look at the advisors that are around our president and the advisors around our governor, and there is not a one of those that's qualified to make any recommendation. There's not one of them. Our governor has said that he takes his advice from Fauci, Birx, Hellistat, and McClellan. Not one of those has seen a patient in the last 30 or 40 years even, has any current knowledge of what it is to be out there actually doing something that benefits individuals' treatment. Yet that is what is guiding where we're going and creating this situation, Mark, that you just described, that says that, folks, we are now over the cliff with where we're going, and we have a generation of kids now that are going to be, or that are in the mode of irreparable of what they're experiencing, and it's only getting worse each day. And so I hope people are listening to that. I hope people will take note of that. And what I'm still amazed at is the lack of outrage and the sheeple response that I see. I just got someone from an early conversation sent me a graphic that I'd been looking for that I had seen once and then couldn't find it again. And I'm gonna post it. It's gonna be put up, but it's a picture of people in a park on a path, and they're on their hands and knees, crawling along the ground. Got gloves on, and but their hands and feet, they're just bent over. And the caption on it says something to the effect that the government has warned us that there is an unknown virus that hovers 3 feet above the ground. And so that's everybody out there. And that's what we have. What I've seen, I've experienced the same thing you have with the mask police, the self-appointed mask police out there. And it is just appalling of where we are. And so, is there one last thing anybody like to say quickly before we sign off on this session on mask? Well, let me just, unless somebody else has something, let me close it out with reminding folks, when you talk about, it's time for us to move on from this, think about where we are today compared to where we started this back in March, when we were going to have the 2-week shutdown to supposedly flatten the curve. And for those of you who don't understand, flattening the curve does not mean reduce the number of people who die. It means spread it out over a longer period of time. And we did that based on what we were being told. And then a couple of those things were that, one, they were by August, again in March, being told that by August, there would be 750,000 Texans dead. And that included if we did social distancing. That was in the model. Social distancing was in the model. That was going to be about 2 million Americans were going to be dead. We were told that everybody is equally susceptible to it. It didn't matter whether you're male or female, black, white, or brown, what your age was, it was going to affect everybody equally. And there would probably be at least a 7% death rate to it, and that there was no medical treatment available. Now you think about what I just said, that's enough to scare the willies out of anybody. And that's exactly what they did. And that was the purpose of it. The problem was there was not one scintilla of truth in any of that. But let's say it was. Let's say that we thought it was going to be 750,000 dead by now, and our number right now today is about 12,000. I don't see how you classify that anything other than a sterling victory in what has happened. I don't understand why the goalposts keep changing, why there's no definition of success, why we have stayed in a defensive mode and have kept our medical doctors sidelined in what is a medical emergency, any more than I can understand keeping our first responders sidelined when we have a fire or a riot or a hurricane. It doesn't make any more sense than that. But here we are, supposedly 750,000 dead. We're only at 12,000, but we're still talking about, we've got people that have this mask mandate has now been extended through November in some places automatically here. Something has to happen to change this. And so I hope the folks that are watching this will wake up and become active and enraged over what was being done to them. Because until the people do and stop just voluntarily going along with anything they're asked to do like this, no matter how absurd it is, nothing's going to change. And so I thank you guys so very, very much for taking your time, for your interest, for your compassion, and just getting to know you, who are actually, I call you real doctors because you are. You are serving the people, and that's what a doctor does. A doctor is a servant of the people. And so I thank you for doing this. Look forward to continuing our relationship, and I'm sure we'll be back together soon with another topic here. So in the meantime, folks, you need to share this video. As many people as possible need to see it and understanding what they're being told. You are being misled with masks, and the bottom line is they're far more dangerous to your physical health and your mental well-being of adults and children by wearing them than any perceived possibly good there is. And it's time to put this to an end. In the meantime, God bless you, each of you. God bless Texas, and God bless America.